And next up, we have Prashant Mehta from the University of Illinois at Urbana-Champaign, and he will speak about his project, which is titled Algorithms and Software Tools for Testing and Control of COVID-19.
Thank you. Thank you for inviting me to speak as part of this. I'll be presenting some work that's done in collaboration with my co-PIs, who are Tamir Bashar and Carolyn Beck, who are colleagues in Coordinated Science Laboratory at Illinois. Philip Parr, who is a CSL alum, he used to be a student of Carolyn Beck, now studied as an assistant professor at Purdue. Rebecca Smith, who was highlighted in Nigel's work, Nigel's talk this morning, plenary this morning. She's the epidemiologist on the team. And Matthew West, who's my colleague in my home department of mechanical engineering at Illinois. So I'll be speaking about project outcomes, accomplishments, which appear as part of publications that are available on archive or through request. I'll follow closely to the results in these papers. I'll summarize the main conclusions of these papers. And the outline of my presentation will stick close to the three papers. Will cover our work in the fall semester on modeling. So this was led by me, and then analysis work that was led by Carolyn, and then the control work, which was led by Philip. And we focused on certain specific issues that will be highlighted as part of my talk. So I'll begin with the modeling work. If you have any questions, my co-PIs are present here. They'll be able to respond in chat. So please feel free to post your questions in chat. So on the modeling side, the motivation for our work comes from the widespread use of compartmental models for simulation, analysis, and control. So the compartments in these models refer to epidemiological states. So most of these models have, say, for example, compartments I and R, which refer to infected or recovered. Some of these models, if that's of concern, they look at the death state, which is denoted as D. Lambda 1 and lambda 2 are parameters which correspond to the rate of transition between various compartments. Now, a common assumption in much of the modeling work is that these rates are the rates of the Poisson counters. In effect, the transitions between compartments is Markovian. So that has an implication which says that the time that it takes to transition from one compartment to another, say for example, I to R, is an exponential random variable. Now, this fact is not really supported by data that's out there. So here I have plotted the histogram of the transition times. These are referred to as delays in literature. So this is for the transition from infected to death. And this is from some data that's made available by CDC based upon 35,000 patients over a period of time. And as you see, the blue curve, which is an exponential fit to this distribution, does not work as well as, say, the black fit, which is for the gamma distribution. So this provides sort of motivation for the technical goals of this work, which are threefold. So one is to develop tools for model validation for looking at delay distribution data. The second goal is to discover model structures. So in particular, the epidemiologist on our team, Rebecca Smith, is interested in understanding possibly hidden states that might be epidemiologically meaningful based upon looking at these delays. And then the final goal is to apply methods for model identification of parameters once the structure is confirmed. So a study like this has to be based upon data. And in our paper, we made a careful effort to look at all the various data sources where the delay distribution data appears. And the details appear in the paper, but let me sort of go through this chart very briefly. So the rows on this chart are sort of the various data sources. So row one is the CDC data that I just talked about. And the CDC data is for a particular transition, I to D. So that's a check mark on the column. Likewise, there's NIH data on other transitions between different compartments. So we'll aggregated all this data, and that informed our study that's reported in the paper that I'll summarize briefly in the next couple of slides. Also, we have an IRB application that's pending with the Illinois Department of Public Health to get patient-specific data from the state of Illinois to apply some of these codes that were developed from this study. And the motivation for our work really comes from sort of the dynamics of this disease propagation. So for example, the work that Nigel talked about this morning, who have highlighted the importance of delays in prediction and forecast in analysis for these models. So here's sort of the couple of slides which will briefly describe sort of the technical results that so we want to sort of preserve the Markovian structure, so we were saying that the observed delays are not exponential. So this means the way we do this is we look at adding additional state. So the model that I showed you before, a natural thing to do is to explain the fact that the delays are not exponential. We add an extra state, and an additional state that for which we have the data is a hospitalization state. So that reflects the simplest enhancement of the basic model. So in the original model, I had the states as I, R, and D, and now I have added an extra state as H. Of course, I don't know a priori fashion what these transition rates might be, or even if this model is actually valid. So the punchline for this particular model is a model invalidation result that we showed in our paper. So let me explain this graph. So the axes on these graphs are probabilities. So the x-axis is the probability that a patient who is infected dies. The y-axis is the probability that a patient who is infected is hospitalized. Now these probabilities cannot be arbitrary. They are constrained by two things. One, they are constrained by the structure of the model, which is reflected here. And then the second thing that they are constrained by is the statistics of the delay distributions that are available. So what we showed was that based upon the COVID data and based upon the structure of the model, the probabilities must necessarily lie in this feasible region, which is visualized as the non-shaded region. On the other hand, the empirical estimates for these probabilities, so for elderly population, for example, the death rate is about 25% for infected people. So based upon the empirical sort of estimates for these probabilities, they fall in the shaded or the infeasible region. So this means that a model that includes just one additional state is not a valid approximation. So again, sort of the details appear in the paper. I hope this sort of gives you a gist of this thing. But really, based upon sort of elementary analysis of the exponential random variables and sums and parallel connections of these random variables, one can derive an inequality for this model structure, an inequality for these conditional probabilities. And this inequality arises fundamentally because the delays have to be non-negative. And then there are certain order relationships between these delays, which depends upon the structure of the model assumed. So essentially the feasible region that I have drawn here is a visualization of these inequalities that I briefly mentioned. So then in the paper, sort of we're going to show that even though adding a single additional state is not a valid approximation, if you add two more states, then you can construct a valid approximation. And this is, the two states have the interpretation of hospitalization H, so this was what we did before. And then the other one is the hidden state in the sense that we don't have a priori the delay data for this particular state. And this was sort of interaction between sort of the modeling people in the team and the epidemiologist on the team, who said, well, the state that you have sort of identified from the data corresponds to the end of viral shedding, which is supposed to be epidemiologically meaningful. So again, sort of additional details appear in the paper. We show that this is a valid model, and then we describe a method based upon a method of moments for identifying the parameters. So these rate parameters for this model. And then this was done for all the data that I sort of described to you in the beginning. For different demographic groups, we could find the values for these rate parameters. And this, in effect, gives you the fits for the delay distributions, which I visualize here for the elderly population. So again, sort of details are described in the paper. As you can see, for the delay distribution from infected to death, this is somewhat closer to the gamma distribution, is well fit by these parameters. So that is sort of a very brief summary of the modeling work. So the next couple of slides, I'll describe the work on analysis. So this was spearheaded by Carolyn Beck along with a student. And Carolyn and her team was interested in the understanding the role of asymptomatic spread in the population. And for that purposes, they looked at a compartment model, the so-called SAIR model. Now in this model, all the Greek parameters are exactly the rates that I talked about before. So beta, sigma, gamma, kappa, and delta are the rates. And then to get to sort of this asymptomatic population, she introduced this parameter Q, which apportions the population who is infected into asymptomatic and that infected symptomatic groups. So as noted in a number of recent studies, asymptomatic spread is very, very important for COVID-19, and moreover, it is difficult to get at asymptomatic proportions from the testing data. So the technical goals of their study were threefold. One was to sort of carry out the stability analysis for the SAIR model for this class of models that I mentioned. The other one was, again, all our work is sort of grounded in data. So she worked closely with data from Champaign and Peoria County. This is the testing data. And then part of her work was to look at the effect of isolation or control strategies on the spread of the virus, particularly in the light of sort of the asymptomatic spread. And this slide is, again, a sort of synopsis of the answers to the three questions that the details of which appear in the paper. So they, by leveraging some tools from nonlinear systems theory, they were able to extend condition for the basic reproduction number, which accounted for this Q parameter, which is the number of asymptomatic people in the population. Then for the data from Champaign County and Peoria County, so this was for the early onset of the virus, April to June region, they figured that the Q value, or the number of asymptomatic in the population based upon the testing data that was reported by these two counties, was anywhere in the range from 40 to 60%, which is sort of consistent with sort of the values that have come out in the latter studies as well. And then the bottom two figures are the answer to the third question, where they looked at, using the simulation models, they looked at the spread if you were to have no restrictions on either the infected or the asymptomatic population. So this is sort of consistent with sort of the numbers that, or the charts that were reported by Nigel in his talk this morning, which shows that over a period of 2 to 3 months, you have 90% of the population which is infected. On the other hand, if you missed out all the asymptomatic people, then this would mean that you would still get a significant spread, having 50% of the people who are infected, which corresponds to the R0 value of 1.5. So it's very important. This sort of adds to the body of literature that says that you need to have testing to identify the asymptomatic people in the population to control the virus. So their study is a very nice validation of that. So finally, I would like to get to the network aspects or the control aspects. So this was work that was led by Philip, um, and and is described in the paper that's available on arXiv. So again, sort of Philip and his team, they worked with the data, and the data that they worked with was again for the early period of the disease spread. The data was for 5 countries: France, Italy, Austria, Germany, and Switzerland. So this is what it's sort of visualized here in the chart. And the data correspond to the confirmed cases on the left, and then the recovered, removed cases in the middle, and then the number of tests carried out. So in the beginning, there were very few tests, but then these tests ramped up. And the technical goals of their work was to infer some of the hidden states, such as the infected, susceptible, and from the testing data by integrating some of the issues, such as delay in this testing, in the testing practices. And then the other goal was to look at some basic control strategies which pertain to sort of the network aspects of this problem. Right. So very briefly, I have a couple of slides which summarize the main conclusions of their work. So the block diagram is sort of how they looked at the problem. So there's data that's available, and these are the observed states. So I is the node on the graph, corresponds to one of the countries, and then the observed states are number of tested, confirmed, and recovered/removed. So these are the pictures that I showed you in the prior slide. And then the hidden states are the susceptible, infected, and the recovered fraction in the population at each of these nodes. So they describe sort of a Bayesian nonlinear filter strategy to estimate the hidden states from the time series data. And what they do is they use this sort of estimates to create an estimate for the value of R naught and R naught hat, because it's an estimate which is based upon these estimated quantities. And then for the control, so this is the second part of the approach, what they do is they try to minimize the effective reproduction number by directly controlling the rate parameters in the model. So gamma is the rate parameter associated with the recovery rate, and beta is the rate parameter associated with the infection rate. Beta I means that this is the rate at the ith node. Now this is sort of slightly unrealistic, but they want to see, what a coarse knob would do. So for example, recovery rate parameter depends upon healthcare personnel, resources, medical equipment, etc. So they said, okay, if we double the rate parameter, what's this going to do to this? So that's the kind of study that they did, and so this is the graph that they had on the inferred quantities. So the y-axis is the fraction of people who are infected in the country of Germany and in the country of Italy on the right. And then if they did this optimization, then they showed that with just the resources that were available at that point of time, they could significantly lower the number in Italy. And then if they were to double the resources, then they could, so that's the purple graph, they could significantly lower both in Italy and in Germany. And the additional results appear in the paper. So I just want to take like a half a minute to acknowledge the wonderful students and postdocs who made this work possible. So Shauki B gets all the credit for working with Carolyn Beck on the analysis portion of the work. Humphrey Long worked in Purdue, so graduate student in Purdue, worked with Phil. Jameson, Mori, Yagiz, these are the people who get the credit for the modeling work, epidemiologist working with control theorist, and then Eric Melling is the postdoc who's involved in all aspects of the work. Thank you.
Great, thank you, Prashant. We have a couple minutes for questions, if anybody has a question from the audience.
I have a question about the network model part. I was curious if when people model the propagation of the epidemic in the US, I mean, do they model states as nodes and in a network, or do they just do it for individual states separately? I mean, and does the addition of a network provide better inferences? Are there case studies on this?
Phil, are you are you able to take this?
I can, yeah.
Yeah.
So there have been some studies that have looked at county level and state level. The inference work we were doing was just looking at local data, so it wasn't dependent on the network. So it could be applied to these just regular group model where you're modeling the population as in a single compartment model with different population with the proportion of the population cut up. But yeah, there has been work at looking at provinces in China as well, where they're looking at spread across these network models, and transportation has been added in, and different aspects of mixing between these different nodes in the network.